Knee pain due to arthritis is the second most common diseases a patient visits an orthopedic surgeon. We have with us Dr. Parthasarathi Srinivasan, Head of Department Orthopedics, Dr. Mehta's Multi-Specialty Hospital, to help us understand more about arthritis. Hello, Doctor.
Hello.
Doctor, what is arthritis?
So arthritis is actually any inflammation of the knee joint due to any cause which leads to swelling, pain, and occasionally at later stages deformity of the joint.
Doctor, what are the causes of arthritis?
Arthritis can be due to many causes. The most common cause in the elderly is a degenerative kind of arthritis where there is wear and tear due to aging. The second most common cause is an inflammatory arthritis, which is due to immune deficiency status like rheumatoid arthritis and other such inflammatory arthritis. Less common things that cause arthritis, including a post-traumatic injury to the knee where the articular surface is disturbed and there is an arthritis leading from that.
Does arthritis happen in children?
Arthritis per se is very rare in children. The degenerative type of arthritis is non-existent in children. However, inflammatory arthritis does happen, and if it occurs in children, it can be quite severe and disabling and may require early treatment in the form of a surgery.
What are the symptoms of arthritis? When do one consult a doctor?
The most common symptom of arthritis is pain. Knee pain that is usually worsened with activity, especially activity that puts a strain on the knee like sitting on the floor or climbing up steps. However, the pain is variable. Some days the pain can be extremely severe, that's called an exacerbation, and some days it can be mild or negligible. When the pain is severe, usually it occurs due to some trauma the previous time. Maybe the patient had a small fall, or occasionally because of an excess of activity due to some event or going to a temple or any such thing that led to some extra walking. And this kind of exacerbation can be handled very well medically, and patients should consult a doctor when they have an exacerbation of pain.
How do you treat arthritis?
So, at the start, we must understand that arthritis is a progressive condition. Arthritis cannot be cured and cannot be completely driven away or taken out of the body, because it's not per se a disease but a wear and tear due to whatever reason. Now, once we understand that, then the idea is to manage the patient so that they have a comfortable, pain-free lifestyle which allows them to do all the activities that they want. So when we try to treat patients with arthritis that we have diagnosed with arthritis, we will be dealing predominantly with the degenerative type of arthritis, which is due to wear and tear. And this kind of arthritis is best treated first by a lifestyle modification, where we advise the patients not to sit on the floor, not to squat, and probably not to climb stairs, because these activities lead a lot of stress on the knee and cause more pain. The other thing that we tell them is that they need some form of exercise, and walking on flat surfaces is usually not that high impact and does not damage the knee. So it's not that walking is not allowed. However, more strenuous activities like running are discouraged. A better form of exercise would be swimming or working on an elliptical, where these kind of exercises have minimal or no impact on the knee, but keep the patient fit as well as the joints mobile and the muscles surrounding the joints in good shape. That is usually the basis of treatment, a lifestyle modification which allows fitness and excludes certain activities so that the pain does not exacerbate. The other part of it is to manage the patient during an acute exacerbation where the pain is high, and this can usually be managed with a short-term course of anti-inflammatory drugs as well as physiotherapy. When this happens, then the patient generally, the pain comes down and the patient goes into the phase where there is a remission and where there is very little pain, and they are able to do most of their activity. And you can then continue to treat them as and when exacerbations arise. However, some patients, as the disease progresses, tend to have more symptoms and have more frequent exacerbations. In these patients, certain types of food supplements which increase the fluid in the knee as well as the lubrication of the joint as well as certain types of injections which supplement the synovial fluid, which is the fluid inside the joint, can be attempted. However, there's the scientific evidence to prove a definite benefit is still lacking. This is still classified only as a food supplementation, and hopefully they can make the patient feel better. The other thing that quite a few surgeons recommend is a steroid injection into the joint. The steroid injection into the joint can be attempted once for pain relief alone, but usually this is in end stage cases, and it's preferable not to inject steroid into the joint because it causes a lot more harm in the long run. Finally, when all else has failed and the patient's activity is severely restricted, we are left with no option but to offer surgery. Surgeries come in two varieties. One is a realignment surgery, where the deformed joint is put into a better position, sort of comparative to a balancing of your car tire, where we make sure that the stress on the knee is even. And this kind of surgery is prescribed for patients below the age of 50 who are suffering from arthritis at a much younger age. They then do better because the realignment redistributes the forces on their knee and they have much less pain. However, in older patients, especially those above 60, if they have end-stage knee arthritis with a lot of pain and deformity, then we suggest that they have a total knee replacement surgery. A total knee replacement surgery is nothing but resurfacing the ends of the bone, the thigh bone and the leg bone where they meet at the knee joint, to provide a stable interface which is painless. The knee joint is usually made of metal with a plastic insert in the middle, and this decreases the pain as well as surgically corrects the deformity. It is a highly successful operation, and in patients who have no other resort left to for the severe pain of arthritis, a total knee replacement is a good solution.
Thank you, doctor. Thank you for helping us understand about arthritis. I'm sure a lot of people will be benefited by this. Thank you.